Okay, everyone, welcome. We truly are so glad that you are here and you joined us this afternoon for our long-term care options class. Before we get started, I see that there are a few questions in the chat coming up, and that is perfect. Please feel free to utilize the chat as much as you would like for any questions, any comments, any feedback. We will be looking at that and we will absolutely be responding to the best of our ability. Again, you're here at the long-term care options class. This class is being recorded, so it will be available for you to look back at. And after the presentation is over, once I'm able to process the recording and all of that, I will be sending a follow-up email with all the slides from the presentation as well as the recording. And Gabby and I, our plan for questions is that we will, towards the end of the presentation, we do think that we're going to be done early. We scheduled 2 hours. We don't think it's going to take that long. And so at the end of the presentation, we will have time for question and answer. If for some reason we don't have enough time to get to everyone's questions, what we'll do is Gabby and I will meet afterward, go over the questions that you asked in the chat, and then we'll follow up with those answers when we send the slides and the recording out. I do see a question asking if you're muted because this class is set up as a webinar format. So everyone is muted and no one is able to unmute themselves. A big part of that is for confidentiality. That's part of the reason we're able to record this so that you can all view it at a later time. Or if for some reason you have to leave early, you'll still have access to the materials. So everyone is muted. As far as I am aware, you're not able to unmute yourself. So if you do have questions, comments, feedback, anything, please be sure to add that to the chat. Okay, so again, welcome everyone. Thank you for your patience in us getting started. Our class today, long-term care options. This is being put on by the Caregiver Resource Center, Orange County. My name is Rachel Smythe. I'm the education coordinator here, as well as one of the family consultants. And I'm joined today, my co-facilitator is Gabby Vendries. She's one of our community liaisons here at Caregiver Resource Center, or CRC, you might hear us say as well. Before we get into the bulk of our material today on long-term care options, we do want to make sure that we've shared a little bit about our agency and what it is that we do here. So with that, let's see if I can manage this slideshow. Perfect. So the history of Caregiver Resource Center, Orange County. We've been a nonprofit program in Orange County since 1988, meaning this is our 35th year serving the community. We're a program under St. Jude Medical Center, which is under the umbrella of Providence Healthcare. We are one of 11 sites throughout the state of California that are part of the Caregiver Resource Center system. So even if you're not in Orange County and you've joined us today, there is a Caregiver Resource Center that serves your county as long as you're in the state of California. Our funding is through the Federal Older Americans Act and the Family Caregiver Support Program. So our mission here at Caregiver Resource Center is to increase the quality of life of caregivers by helping families and communities master the challenges of caregiving. And our mantra here is caregiving includes caring for me. What we mean by this is it is so important for you as the caregiver to take care of yourself as well. Oftentimes, caregivers put themselves on the very back burner, absolute last, and it's not just something that you should do or we hope that you do. Caregiving, including caring for you, is critical. Making sure that you're taken care of too so that you can continue to show up and care for your loved one is so important. So again, that's our mantra here. Caregiving includes caring for me. Most of our services fall into these 6 categories here on the screen. Our 6 main areas of service, one being caregiver support groups, where caregivers can meet with others who are going through the same experience and really find that connection and that community. We also provide assessment and care planning, so helping look at long-term care options like our class today, and just trying to help you figure out what will be your plan moving forward. We also provide education and training like this class that you all joined today. And our training and our education program also does include legal workshops. We're able to provide individual counseling as well. We provide specialized information related to caregiving issues, and then we also offer respite assistance when funding is available. Respite assistance means a grant that allows you to have in-home care so that you can take a break from caregiving for your loved one and have some time for yourself and to focus on your own well-being. Our respite also includes out-of-home care options, cleaning services, and supplies. Again, this is when funding is available. If you're wondering if you might be eligible for our services, or if you are a social worker or a case manager who's on this call today, and you're wondering if you have a client that would be eligible for us here in Orange County, these are our eligibility requirements. The person who is the caregiver and the care receiver must both reside in Orange County. And then we define a caregiver as someone who is an adult, so over 18, and caring for someone who is over 60 and needs help with their activities of daily living, eating, bathing, showering, walking, transferring if they need help with these activities of daily living, or they're elderly and frail, or have chronic health conditions. And if the person that you're caring for is under 60 years old, that's okay as well. They just would need to have an adult onset cognitive or brain impairment. So they might have had a traumatic brain injury or early onset dementia or Alzheimer's, and you would still qualify for our services. If you're not sure, just give us a call. We're here to help. We're here to serve the community and caregivers. So again, if you're not sure, just give us a call. We always have social workers available to provide support. So with that, that's a little bit about Caregiver Resource Center and what it is that we do. And now what you all came for this afternoon, long-term care options. And the way that we've broken up this class is the first half of the class, we're going to be talking about in-home care options. And the second half of the class, we'll be talking about out-of-home long-term care options. And we do have a few goals and objectives for the class this afternoon. We're hoping that you'll learn about different types and different levels of long-term care. We also are hoping that you'll have a better understanding of costs of care and who covers what. And then we also want to share so that you have an increase in awareness of Medi-Cal, Medicare, and other health and long-term care benefits. So with that, I'll turn it over to Gabby. She's going to start us off with talking about the different in-home care options.
Thanks, Rachel. And good afternoon, everyone. So let's get started with our in-home care options. The ones we're going to be discussing today are in-home caregiver, there's home health, adult day programs, and palliative and hospice care. So let's start with the in-home caregiver. So with the in-home caregiver, you will receive assistance with activities of daily living, such as meal preparation, dressing, grooming, medication monitoring, transportation, and light housekeeping. This may also be called custodial care, personal care, or companionship. This is not medical care, so they do not provide any progressive treatment. Some ways to find an in-home caregiver. So you can go through an in-home caregiving agency. If you're in Orange County, you can always call our center for a list. You can go about getting a private caregiver through a website ad or word of mouth. There's a program through Medi-Cal called In-Home Supportive Services, where you will receive an amount of hours, paid caregiving hours, and to hire a caregiver to come in. And then you can also go about it through your long-term care insurance or through your VA benefits if you're a veteran. So the cost and coverage of an in-home caregiver. So if you were to go through an agency, the out-of-pocket cost could range from $25 an hour to $40 an hour. It just depends on the level of care that you're looking for. It's usually not covered by Medi-Cal. If you were to go about getting a private caregiver, it would just depend on the contract you make with the caregiver. And again, there's no coverage through Medi-Cal. If you were to go through the Medi-Cal program, in-home supportive services, no cost would be out of pocket. So when you apply, you'll be giving a certain amount of payable caregiving hours a month. And if you like additional hours, you can apply for something called protective supervision to receive the max of $283 a month. And you can also go about it through your long-term care insurance. It would vary on your plan, and it's usually not covered by Medi-Cal. And I'll pass it to Rachel to talk about adult day programs.
Perfect. Thank you, Gabby. And I just wanted to point out two other things. One being that in-home caregivers are probably the most often utilized when it comes to long-term care options. That's very, very common. Also, I told myself about 100 times to tell you all, and I forgot, but that this is going to be a lot of information. We're going to talk about a lot of options. Try not to be overwhelmed. I know it will be a lot of information. We absolutely acknowledge that. And the goal of this program today is to really give you an overview of what these different options are. Truly, Gabby and I would be able to have a full class on every single one of the things that we'll talk about today. And we might at some point, but for today, this is just an overview. And towards the end of the presentation, we'll be sharing about who you can call for what services, depending on which of these topics that we talk about resonate with you and your caregiving situation. So again, we know this is a lot of information, okay? So adult day programs. Some of us have heard of them, some of us have not. And what an adult day program is, it's a supervised community setting, often for older adults, but typically anyone over 18 can attend these programs, but more often than not, they're older adults, some of which have dementia or Alzheimer's or other chronic health conditions that prevent them from being home alone safely during the day. Another reason someone might go to an adult day program is perhaps their caregiver works full-time and they are not able to be at home alone. So they go to a day program, which allows their loved one to continue working. Or maybe their loved one or their caregiver just needs a break, needs some respite. And a day program could be a great way to allow someone to continue to live at home and have their caregiver still work, and also just to keep the older adult engaged and active. And so when we do this class, sometimes we get questions as to why a day program, which happens outside of the home, is in this in-home options section. The reason for that is because an adult day program is really designed so that your loved one can stay at their home or at your home or in the community setting of their choice. Again, oftentimes if you're working or your loved one's not home, cannot be at home safely, that's the reason someone might be institutionalized or moved prematurely when they didn't need to yet. So although your loved one will leave the home to go to a day program, the real purpose of these programs is to allow someone to continue living in either their own home or their family's home. So there are a couple types of adult day programs. Typically, they fall into one of two categories, which would be a social model, also known as adult day program or ADP. And then we also have a medical model day program. There are two medical models. One is called adult day healthcare. The other is community-based adult services. Just to confuse everyone more, these are essentially the exact same program. The only difference is who's paying. So like Gabby talked about with in-home supportive services, that's for Medi-Cal recipients. Community-based adult services is also a Medi-Cal program. So again, same services as adult day healthcare. It's just adult day healthcare is typically a private paid program or paid for by special programs like the VA or long-term care insurance. But again, these are the exact same program, just different funding sources. And just like I said, this was going to be a lot of information, so try not to let this slide overwhelm you. The purpose of this slide is to show you what is included in the social model program and then what's included in the medical model program. So as you can see on the top half of this chart, things like an individual plan of care, an activity program, dietary services, meals and snacks, transportation, and personal care and supervision are included in both social model and medical model day program. In a medical model, there are additional services that are provided, things like help with medication, social work services, skilled nursing. There's a medical doctor who oversees the program. There's access to mental health services and therapies such as physical therapy, occupational therapy, and speech therapy. These are only included in the medical model. The next slide, we're going to talk about the cost and coverage. And because of these extra services, you'll notice that there is a little bit of a higher daily fee for the medical model rather than the social model. So the cost and coverage for that social model program, adult day program, typically if you're paying out of pocket, it ranges between $75 to $90 a day. Keep in mind that this is really based out of California and Orange County statistics. It may be different if you live elsewhere. What's really nice is that the social model, oftentimes centers may have scholarships or other support that allows your loved one to go for either no cost or a reduced cost. The social model, there's no coverage with Medicare and there's no coverage with Medi-Cal. I did include to check with your Medicare plan here. The reason being Medicare is starting to include maybe 1 day per week for some Medicare plans to attend a day program, which is amazing. It's great. And so I did put no coverage, but check with plan because your plan may start to offer it. But generally there's not coverage by Medicare or Medi-Cal for the social model. When it comes to the medical model, here in the center column, you can see adult day healthcare. And as mentioned, the cost per day is a bit higher because of those additional services. It ranges from about $95 to $110 per day. And again, no coverage with Medicare or Medi-Cal. But community-based adult services is covered by Medi-Cal. Again, that's a Medi-Cal program that's only accessible to Medi-Cal recipients. So Medi-Cal will pay for up to 5 days per week for your loved one to attend the medical model community-based adult services program, which is fantastic. Again, there may be other options to assist with some of these costs. Like I said, some centers have scholarships or other assistance. The VA does also provide some support with paying for these types of services. Long-term care insurance can assist. Programs like ours, Caregiver Resource Center, offer grants. And there are also foundations and disease-specific organizations that may also be able to help. So that's adult day programs. And we'll move on to our third in-home care option related to long-term care, and that is home health.
Yes, so let's get into home health. So what is home health? Home health is skilled medical and supportive specialized care services in your home. So they offer things like wound care, intravenous nutrition therapy, and they monitor your illness. And basically the goal of home health is to help you recover from illness or your injury. So they help you recuperate and regain your independence. So a lot of the times home health can be confused with in-home care. So we made this chart here to kind of spell out the differences. So with home health, it's basically a skilled nursing service. You will receive a professional medical assistance. With the in-home caregiver, it's non-medical care and support with your ADLs. Some examples of services offered by home health would be physical therapy, occupational therapy, administration of medication, wound care, speech therapy, and their nurses create a care plan for the patients. And with the in-home caregiver, again, it's just companionship, assistance with dressing, grooming, meal preparation, and light housework. So with home health, it's prescribed by a doctor usually, and it's short term. And with the in-home caregiver, you can request it on your own, and that can be long term. So the cost and coverage associated with home health. So if you were to go out of pocket, the cost would vary. It's usually higher, a higher hourly rate, especially if not prescribed. And it's covered by Medicare and Medi-Cal if prescribed by your doctor. You can also call your physician or your insurance to request home health as well. And then Rachel's going to talk about palliative care and hospice.
Perfect. Thank you so much, Gabby. So palliative care and hospice, I think most of us have probably heard these terms before, but maybe don't have a full understanding of what these services entail. There is a lot of misunderstanding around these services, and these can be topics that feel a little bit scary for caregivers. And so we want to kind of dispel some of those myths and really give you some more information so that if this is something that would be beneficial for you in your caregiving situation, that you have a bit more of a knowledge base and can move forward with pursuing it if it feels like that's what's right for you in your caregiving situation. So palliative care and hospice, they both offer relief from pain and symptoms of a serious illness. These programs also address the emotional, social, and spiritual needs of patients and their families. And Gabby and I laughed when we were getting ready to do this presentation because of the analogy or metaphor that I came up with for thinking about palliative care and hospice is a little silly. But if you can see the image here on the right-hand side of your screen, I thought of this like this pizza, okay? And who doesn't like pizza first and foremost? But palliative care is the whole pizza, okay? It's symptom management of a life-limiting illness. And then think of hospice as one slice of the pizza of palliative care. And that hospice is symptom management and comfort care at the end of life. I may regret including that analogy, but hopefully it made sense to everyone. So hospice is this little subsection of all of palliative care. And then for those of you who kind of prefer to see things visually, we have a chart here of what the differences are between palliative care and hospice. Again, these often go together because of that pizza and slice situation, but they are different programs and they do different things. So palliative care is for individuals with chronic or progressive illnesses, but they're still seeking curative treatment. There's no life expectancy requirement to receive palliative care services. Palliative care manages symptoms and assists with advanced care planning, while again, also still receiving aggressive or invasive treatment. Palliative care is provided in conjunction with primary care doctors and specialists that you already see. So you continue to see your regular doctors and medical providers, and then you also have this additional layer with palliative care. On the other hand, hospice also focuses on chronic or progressive illnesses, but the focus is on comfort, not on a cure. So you're no longer seeking curative treatment. You're focusing on comfort care. Typically with hospice, you're required to have a life expectancy of 6 months or less, and you do get recertified. So you can remain on hospice longer than that, but typically they would expect that you have that life expectancy of 6 months or less. Hospice manages symptoms and helps the patient and their family transition with end-of-life care. When you have hospice services, the hospice physician and the hospice medical team take over care completely. You no longer see your primary doctor or specialists. All care comes directly from the hospice team. So again, those are really the main differences between the two. And we will talk a little bit more about palliative care here and hospice on the next slide. And the reason we keep talking about it might seem a little repetitive, but we really want to help kind of clear up some of these myths or unknowns about these services. So palliative care, again, it's a specialized medical care for individuals living with serious illnesses, things like cancer or heart failure, at any stage of the disease. And so patients in palliative care may still receive medical care like we talked about, along with treatment intended to cure the illness. So comfort care and curative treatments. And then palliative care is meant to enhance a person's current care by focusing on quality of life for them and their family. Hospice, again, you have that anticipated life expectancy of 6 months or less, and the focus is on symptom management and quality of life. And hospice consists of an interdisciplinary team that's trained to address physical, psychosocial, and spiritual needs of the person and their family. Hospice care is a type of specialty care that is really person-centered. It stresses the coordination of care, goals of care, and communication is really important. Hospice is typically provided where someone lives, so in their private residence, but it can also be provided in a nursing home or a different community living arrangement. Again, hospice is typically provided at home though, but it can be provided elsewhere. Care also consists of visits to the patient and their family. Visits come from registered nurses, from a hospice doctor, from CNAs to help with bathing and other personal care as well. And hospice providers are available by phone 24/7 should concerns arise. So instead of calling 911, more than likely you'd be calling the hospice agency for support should any issues come up. So cost and coverage of palliative care. So if you were paying out of pocket for these services, palliative care is just about an average of $95 a day to start. And then hospice care has quite a range depending on the individual's care needs and level of care required. It goes anywhere from about $150 per day up to $1,400 a day. The good news about this is that both Medicare and Medi-Cal generally will cover both palliative care and hospice. With Medicare, as long as they are an approved agency for palliative care or hospice, as long as they're approved by Medicare already, they cover the costs. And then again, Medi-Cal also covers the cost of these programs. So it's very rare that you would be having to pay for palliative care or hospice out of pocket, unless you had a very specific agency that you wanted. But otherwise, you should have coverage for these, which is great news. Okay. And then, so those were the 4 primary areas of in-home care related to long-term care options. And now we're going to go ahead and first take a breath, because again, it was a lot of information. But we're going to start talking about out-of-home care options now. And Gabby will start us off.
Thanks, Rachel. So the out-of-home care options we're going to go over today are residential care facilities for the elderly, or RCFEs, continuing care retirement communities, or CCRCs, and skilled nursing facilities, or SMF, or commonly known as SNF. So let's start with residential care facilities for the elderly. So with these facilities, they provide room, board, housekeeping, supervision, and personal care assistance with personal hygiene, dressing, eating, and walking. They provide non-skilled, non-medical care. So some options of RCFEs would be an assisted living, a boarding care, or a memory care. And we'll go over each. So the first is assisted living. Assisted living is a type of housing designed for people who need various levels of medical and personal care. Living spaces can be individual rooms, apartments, or shared quarters. They can have as many as 16 to 120 beds. These facilities generally provide a home-like setting and are physically designed to promote the residents' independence. Services are offered to assist residents with daily living. And here we included a picture of a typical assisted living facility. They are large and they have a high capacity, again, like up to like 120 beds. There's usually space for folks to do engaging in social activities, and everything is designed to promote and sustain the residents' independence. Next, we're going to talk about boarding cares. So boarding care homes, also called residential care facilities or group homes, are small private facilities with 20 or less residents. Most common is a maximum of 6 residents. Rooms can be private or shared. Residents receive personal care, meals, and have staff available around the clock. Nursing and medical care are usually not provided on site. So if you had a loved one with a need for ongoing skilled nursing assistance, this probably would not be the best fit. And we included a picture of a typical boarding care home. Again, they are smaller, from like 6 to 20 beds, and they tend to be in like regular residential homes. They're usually staffed by a family or a caregiver who lives there and assists the residents 24/7. Next, we're going to talk about memory cares. So memory care is designed to provide a safe, structured environment with set routines to lower stress for people with memory loss. Staff provides meals and helps residents with personal care tasks, just like the staff at an assisted living facility, but they are also specially trained to deal with the unique issues common with dementia or Alzheimer's. So the staff, they check in with residents more frequently and provide extra structure and support to help them navigate their day. And here we have an example of the inside of a memory care. As you can see, everything from the colors in the room to the interior design is structured to reduce the resident stress. And they are staffed by caregivers who are specially trained to manage the dementia-related symptoms. So our next type of out-of-home care would be continuing care retirement communities. So continuing care retirement communities, also known as CCRCs, or life plan communities, are a long-term care option for older people who want to stay in the same place through different phases in the aging process. So here we have a map of a typical campus of a CCRC. So they are designed for residents to stay in place as they progress through different levels of care. So for example, in the picture, like building A could be their assisted living section. And again, like the building D can be their skilled nursing facility. So it's an all-in-one campus. The cost and coverage with RCFEs. So with the assisted living, if you're to go about paying for it out of pocket, the average cost could be $4,500. They're not covered by Medicare, and you could receive assistance through the assisted living waiver program that we'll go over later in the presentation. If you wanted to go through a boarding care, the cost can be around $3,000 for a shared room, or $4,000 to $7,000 for a private room. And those are not covered by Medicare. And again, you can receive assistance through Medi-Cal. With a memory care, the average cost is $6,500, not covered by Medicare. And again, you can receive assistance. And then with the continuing care retirement communities, the entrance fee are usually around $400,000 or $4,000 monthly. They're not covered by Medicare or Medi-Cal. And then Rachel's going to talk about skilled nursing facilities.
Thank you, Gabby. So skilled nursing facilities, and also just a reminder to everyone, we are continuing to monitor the chat. We see the questions that you're asking, and we really appreciate you engaging with us and asking those questions. We will do our best to answer them at the end. And even if we can't get to everybody at the end, we will do follow up and answer those questions that you have asked, okay? So skilled nursing facility. So this is something that a lot of people are probably already familiar with. A skilled nursing facility is transitional care that takes place in a medical facility. Typically, someone is referred to a skilled nursing facility or a rehab after a hospital stay. That hospital stay may be due to an illness, it may be due to an injury, or perhaps they had some type of surgery. And this happens when someone is too stable to remain in the hospital. That very high level of care is no longer necessary, but someone may not be quite ready to go home safely. So this is this in-between place where someone goes for that higher level of care and also those rehabilitative services. So medical staff are available at a skilled nursing facility. Generally, that includes CNAs, registered nurses, and doctors who oversee your loved one's care. And nursing care is available 24 hours a day, 7 days a week. Other services that are available in a skilled nursing facility are things like physical therapy, occupational therapy, speech therapy, social engagement activities, meals, and assistance with personal hygiene as well. And then cost and coverage of skilled nursing. So you'll see here that I have two columns, one skilled nursing facility, and on the right is nursing home. When we're referring to skilled nursing facility, what we mean is that's that transitional care. Somebody was hospitalized, they need support before going home, they need to rehabilitate after having a knee replacement or hip replacement. And so that's what we mean by skilled nursing facility. And then in contrast, on the right-hand side, nursing home is when someone requires that higher level of care at all times, meaning they have care needs that they will not be able to return home. So for some, this level of care is where they will stay for their long-term care or a quite extended stay. And so that's what we mean when we have these two comparisons here. So the out-of-pocket cost for skilled nursing or rehab, private room is about $400 a day, and a semi-private room is about $320 a day. Medicare does have some coverage for that short-term skilled nursing or rehab. Typically, days 1 through 20 after a hospitalization will have zero coinsurance, so they're completely paid for. And then days 21 through 100, it can go up to $194 per day. And then after days 100, so 101 and beyond, typically no coverage. Again, this is supposed to be short-term, a rehab type of scenario. Medi-Cal does cover this as well if there's prior authorization from a physician. Alternatively, a nursing home, again, or extended or long-term permanent living arrangement, private room about $300 a day, and a semi-private room could be about $260. There's no coverage for this type of long-term stay through Medicare. There is none at all. Medi-Cal does have coverage if there's prior authorization from a physician. And so the cost is a bit lower for that than rehab because there's not all these extra services like the physical therapy and all those other items that would be provided when somebody's doing rehab with that goal of going back home. And then throughout the presentation, Gabby and I have both said Medicare and Medi-Cal many, many times. And I'm sure these are words that you've heard before, but maybe don't have a full understanding of what they are. How do you get them? What can you use them for? So we wanted to take some time to talk about what these programs are and how they can help you, what's covered as it relates to long-term care options. So Medicare versus Medi-Cal. As you can see on the left, these are our Medicare cards. There's two different types. Medicare is generally an age-based program. So most people with Medicare are 65 years old and up. But if you are under 65, you may still qualify for Medicare if you've been deemed disabled. There are different requirements and stipulations, but you are able to have Medicare under 65 if you've been deemed disabled. On the right, you can see our other two cards. This is a Medi-Cal card. One has these orange poppies on it. The other is a benefits identification card. And generally, this program is everywhere else other than California. It's referred to as Medicaid, but here in California, we call it Medi-Cal. And this is an income-based program. So there is no age requirement for this program. You can have Medi-Cal at any age. There are limits on assets and income, and so that's really the difference. Just to kind of break it down a little bit more to give us all a better understanding of these programs, Medicare typically has 4 parts. You've probably seen commercials on TV. I know I have of Medicare Part A, Medicare Part B, Part C, and Part D. And so Medicare Part A, that covers inpatient hospital and nursing facility stays. That's the part of Medicare that covers hospice and some home health. Typically, premiums for Part A are covered because of payroll deductions from when the person was still working and employed. Medicare Part B, this is coverage for doctor's visits, for medical supplies, and outpatient care. And there is a monthly contribution, but this is typically removed automatically from your Social Security payments. So you might see on your Social Security letter when it comes each month, $1,500, and they'll say minus Medicare premium of $140, and then what you actually get is, that whatever that would be, $1,360, I think. Please don't judge my math. I did my best. And so it's typically taken out already when you get your Social Security. Then there's something, and also just to note, so together, Medicare Parts A and B, that's typically going to be referred to as traditional Medicare or original Medicare. So if you hear someone say traditional or original Medicare, it means together A and B, these two parts. So inpatient as well as kind of outpatient services. Then we have Medicare Part C. What Medicare Part C is that's a Medicare Advantage plan. So it's just an alternative or insurance plan that's offered by private insurers, and it provides that traditional Medicare, so Parts A and B, as well as prescription drug coverage, all under a single policy. So it's really combining A, B, and then D here at the bottom, and that's what we would call a Medicare Advantage plan. A Medicare Part D plan is, it's been around for about 20 years, and it provides prescription drug coverage. It's available through purchase through private companies, and premiums are often subsidized by the government. And again, just for those of us who are visual learners, Medicare again has these main 4 components: Part A, B, C, and D. Part A is hospital coverage, Part B is medical coverage, Part D is prescription coverage, and Part C is that Medicare Advantage, which kind of combines A, B, and D. And again, this is a lot of information, so feel free to rewatch this later. It took me a while to get it all straight so that I could present to you all today. And oftentimes Medicare parts are confused with Medicare plans. Just know that they are different, okay? They're not the same thing. And so Medicare versus Medi-Cal when it comes to long-term care. Medi-Cal goes beyond Medicare's coverage in a few key areas. The most important for us here is the long-term healthcare services and support. Medi-Cal definitely has more options for long-term healthcare services and support. Medicare has limited coverage for long-term care, with most of the benefits being confined to skilled nursing for short periods. Like we talked about those days 1 through 20, zero car insurance, days 21 and on, having to pay for those. And so that's short term, and it's really confined to skilled nursing. On the other hand, Medi-Cal can cover the cost of nursing home. They also have assistance with assisted living facilities and other long-term care alternatives, as long as they're deemed to be medically necessary. So the Medicare long-term care benefits, again, a little less than we'd hope that they'd be, but Medicare does partially cover skilled nursing. Medicare is typically who's paying for home health, and then they also cover hospice care. Also, as you can see here, this list is much more extensive for Medi-Cal long-term care benefits, covers hospital and medical care, dental services, vision services, prescription coverage, physical and occupational therapies, nursing home care, home health, prosthetic and orthopedic devices. It can cover hearing aids, medical equipment, and ambulance services, as well as those other programs like Gabby mentioned, in-home supportive services, community-based adult services, the day program. So there's a lot of benefits through Medi-Cal. A big reason that we're talking so much about Medi-Cal is, again, because of all of these benefits that are available. You may be listening to this and thinking, well, there's absolutely no way I'd qualify for Medi-Cal. I've tried in the past, it's not going to work. We would really encourage you to meet with either a Medi-Cal specialist, contact your local legal aid, or just do some research on your own, because Medi-Cal eligibility has changed pretty drastically in the last year. There's been kind of one change after another, which pretty much all of them have increased eligibility, making it so that more people will qualify for these services than they have in the past. So again, you might think that you wouldn't qualify, or perhaps a few years ago you didn't qualify, your loved one didn't qualify. Please recheck, because there is the possibility that you may at this point. Some other Medi-Cal benefits this is a big one, is spousal impoverishment protection laws. This is designed to prevent the impoverishment or having the spouse who may be well go into poverty when the other spouse enrolls in Medi-Cal. And this means that certain married individuals can be eligible for Medi-Cal with more generous income and asset limits, which enables them to access services without depleting all of their resources that they're going to need for themselves at some point. So that's the whole purpose of this, is to make it so that the well spouse does not go into poverty and deplete all of their resources caring for their spouse who is not well. This has very high asset limits as well as income. So it's different. It's worth exploring. Also, there's home and community-based alternatives waiver under Medi-Cal. What this is it's something that allows Medi-Cal beneficiaries with a higher level of care needs to continue to live at home or in their community setting that they've identified by ensuring that they receive these additional services to help them sustain their health and safety outside of an institution. So this might look like a lot more in-home care. This might mean some nursing support at home. This just means that there's more services in place so that they don't have to go to a skilled nursing facility before they need to, so that they don't go prematurely. Also, through Medi-Cal, there's a program called the Assisted Living Waiver. And as I mentioned, Gabby and I could easily do a class on every single one of the topics that we've discussed. This is just the overview. So the Assisted Living Waiver, what that is it's a program designed to assist Medi-Cal recipients to remain in their community, whether it be in assisted living, aborted care, or memory care, rather than having to go into a healthcare facility or a skilled nursing facility. So again, that can be a way of getting help with either total coverage or majority of coverage of these services that otherwise are not covered by programs and are generally out of pocket. So like I said, we included all of these because we hope that you'll be open to exploring Medi-Cal to see if you may be eligible with all these changes that have happened when it comes to eligibility. There are a few other special programs that relate to long-term care or can help with some long-term care. And so Gabby's going to go ahead and walk us through these special programs as well.
Thanks, Rachel. So the special programs we're going to go over today are long-term care insurance, the Veterans Affairs or the VA, SCAN health insurance, the Caregiver Resource Center, so us, the MSSP program, the PACE program, and the Cal AIM program. We're going to go in depth into each. So the first special program would be through long-term care insurance. So your plan can include coverage of long-term care services like in-home care. The cost of your policy varies on age, policy type, and coverage selected. If you're a veteran, there's a couple programs through the VA that you could take advantage of. So with the pension, you can utilize these funds for care. Through the Cal Vet program, they offer residential care facilities for elderly vets, like assisted living facilities and boarding cares throughout the state. Through the Homemaker and Home Health program, they pay for an in-home caregiver to come in the home for vets. And there's also adult day healthcare program where they pay for vets to go to adult day healthcare program. There is home-based primary care, which allows for vets to receive all of their care and doctor's visits from home. And then there's the aid and attendance or housebound allowance program, which kind of functions like IHSS in a way. They provide funds each month that can go towards any caregiving cost. Another special program would be SCAN Medicare. So SCAN is a Medicare health plan. They offer a respite care benefit. So their respite is designed to relieve a loved one who cares for a SCAN member full-time and without pay. Their respite care benefit includes up to 40 hours of caregiving services per year. The service can be used for 4 hours at a time and provided in the member's home. And the services they provide are support with your loved one with ADLs. So bathing, dressing, meal preparation, so companionship care. And it's important to note that this is not available for all SCAN plans, so please verify your coverage. Another program we're going to talk about is the MSSP program through Medi-Cal. So the Multipurpose Senior Services Program. And their goal is to provide care management to help care management to help elderly adults remain at home. So their program is for Medi-Cal eligible individuals who are 65 years or older and disabled as an alternative to a nursing facility placement. So they're staffed by registered nurses and social workers, and they provide a review of your loved one's needs. They create a care plan. They help with purchasing items, linkage to other programs, and coordination of additional services. Another Medi-Cal program or Cal Optima program would be PACE. So the program for all-inclusive care for the elderly. Their goal is to help older adults remain independent at home. They provide long-term comprehensive health care. They're staffed by interdisciplinary teams, so nurses, social workers, caregivers. And basically, they provide a coordination of all needed preventative, primary, and acute long-term care. Another and the newest Medi-Cal program is Cal AIM. Cal AIM, they provide things such as housing support, recuperative care, short-term post-hospitalization housing. They can assist with transitioning a loved one from receiving care in a SNF to an assisted living facility. They provide personal and home maker services. They provide medically tailored meals, respite services, and environmental accessibility or adaptations or home modifications. And then we listed some numbers of the programs that we just mentioned in their website links. If you needed help with like connecting to any of these programs, you can always give our center a call or call your local 211. And yeah, I'll pass it to Rachel for questions.
Great.
Yeah.
Thank you so much, Gabby. And again, I know that especially with those special programs, it's a lot of information, and some of them are specifically for Orange County. Some of them are programs like PACE is throughout the country. There's PACE sites and PACE programs, not just in Orange County, not just in California. They are in other places as well. So we did get through the presentation much faster than I thought we were going to, probably because we're set up in this webinar format where people can't unmute and ask questions, and I know we get to go back and forth. And so I see that there has been quite a bit of activity in the chat, which we're very, very grateful for that engagement. And so what I'm going to ask is for Gabby, if you wouldn't mind going back up towards the top of the chat, and we can go ahead and try to answer as many questions as possible. So again, this is the opportunity for all of you to type in the chat questions, or again, feedback or things that you want us to do further presentations on. While I was presenting, I happened to notice somebody said they'd love a presentation on the assisted living waiver. So we do take everything that you say in the chat. We take it, we absolutely take it to heart, and we try to make sure that we meet those needs. So what it is that you're looking for, that's what we're here for. We truly do want to serve caregivers the best that we can. So this is your chance to type questions, give us feedback, comments, whatever it is. We're here to help. Okay. And so Gabby, if you're ready, we can go ahead and do the first question. And also just a note, I may not have every answer, but we will definitely get you pointed towards the agency or the person who will have that answer if we don't have it ourselves. Okay.
Mm-hmm. So the first question is from Kim. It's about IHSS. She asked, the max is $283 a month. Is that $283 or hours?
Okay, perfect. Thank you so much for your question, Kim. So with IHSS, the max amount of hours per month is 283. So 283 hours per month, which unfortunately does not cover as much care as you're probably providing, especially if it's 24/7. But that is the maximum with in-home supportive services right now. That's what we call protective supervision. There are waiver programs, the home care and alternatives based waiver, which I completely said wrong, I'm sure, but they do offer more hours. And there is now this Cal AIM that offers additional support, but within home supportive services specifically, it's 283 hours per month. So I hope that helps.
Our next question is from Tamar. She wants to know, does one need to get palliative/hospice care through their own medical insurance?
Sure. So this question does come up a lot. Typically, the way that someone gets their loved one onto hospice care or palliative care is they request a referral from their doctor. That's the most common way, but it is not the only way. So you can ask for a referral from your primary care doctor or from a specialist, a neurologist, kidney doctor, and ask them for a referral for hospice. So that can be done that way. You can also call your insurance directly and ask for a list of agencies that are already covered. And then sometimes people do get in contact with a hospice agency directly and ask them to help support the process. And then what happens is the hospice agency would reach out to the doctor. And essentially what they're doing is providing confirmation that your loved one has an illness that would qualify for these services. So there's really three ways. You can go through your primary doctor or a specialist. You can talk to your insurance provider directly, or you can reach out to hospice providers and they can work with your doctors on your behalf.
Our next question is from Gassan. They want to know, do Alzheimer's patients qualify for palliative care?
Okay. So typically, yes. I don't work for a hospice or palliative care provider, but because Alzheimer's is a terminal illness, there is no cure. So most of the time I have seen individuals and their loved ones qualify with that diagnosis. But sometimes things are subjective. If your loved one has a very early stage of Alzheimer's, they may not qualify. But it's worth exploring if it seems like those services would be beneficial for you and your loved one.
Tamar shared, we are unable to afford a memory care facility, which seems to begin at around $7,000 per month. I understand it is not covered by any Medi-Cal insurance. Is that right?
Okay, so I'm not sure if your loved one has Medi-Cal, then with the assisted living waiver, although the name says assisted living, it really would also cover both memory care and board and care. So it can be a larger facility, a smaller facility, but there is a quite a long list of facilities in California that accept the waiver. So that would probably be the bigger obstacle, is finding a facility that is right for you and your family who accepts the waiver. But to be honest, the list is pretty extensive. There are many, many facilities, both large and small, who accept the waiver, and they do have memory care as well as just assisted living or board and care services. So, but that's strictly with having Medi-Cal. So I'm not sure if your loved one has Medi-Cal. If they do, I would encourage you to get connected with the assisted living waiver. Again, we'll be sending all these slides out, and it'll have resources for who you can contact for more information on the assisted living waiver or any of or Medi-Cal in general. And if you're not sure where to start to, you can always call us and we can give you that information as well.
Our next question is from Therese. They want to know, how do you obtain assistance from Medi-Cal? Do all of your assets, i.e. proceeds from selling a house, investments, etc., need to be used before you can get assistance?
Sure. So with this question, I do not want to give you the wrong information first and foremost. What I always suggest is if you're looking for assistance with Medi-Cal, depending on your income level, call your local legal aid. They have individuals, paralegals and legal professionals who can help look at your situation and see what programs you would be eligible for. Or you can also reach out to Medi-Cal specialists. They, again, can look at your situation and see what would be the most beneficial, what you might be eligible for. Typically, a Medi-Cal specialist will have a fee for service. Legal aid generally does not. So either one of those can be great resources, because sometimes there's these really kind of almost silly things that prevent you from getting Medi-Cal. You know, you were $5 over the income limit, and Medi-Cal, because there's so much computerized, it just automatically kicks that application back as over income. But let's say you're spending $30 a month on eye insurance or a dental plan, and that can actually be taken off of your overall income. It's exempt. And so with that $30 taken off, now you are eligible. And sometimes, Medi-Cal's complicated. There's a lot of rules and a lot of things, and it can be really helpful to have somebody who understands all of that kind of guide you through the process. So that's what I would encourage you to do, because there's a lot of misconceptions when it comes to them taking your home or taking things. And, there's different types of wills and trusts and asset limitations and things like that a specialist could really help you with.
DT acts in regards to SNFs, are they only covered for certain days? And how can you extend if needed for necessary for a medical necessity due to limited days to stay in a SNF?
Sure. So this one would depend if you have Medi-Cal and Medicare, or if you just have one. Typically with Medicare, only days 1 through 20 are covered. They will give you the option of paying a co-insurance after day 20. But with that one, I would say that it's probably best to talk to your insurance directly. And there's another agency that is absolutely exceptional. Their acronym is CANR, California Advocates for Nursing Home Reform. And kind of any questions that you have about your rights, about things like that, they can be extremely helpful. They should be on our who to call for what page when I send this out. If they're not, I'll make sure that they're added. But I can't necessarily give you a correct answer on extending if needed for medical necessity. But typically Medicare will cover days 1 through 20. Medi-Cal, there is more coverage for nursing home stays.
Jennifer asks, in regards to the Medicare parts, what does it mean if my parents have this through Kaiser? And how do you apply through Medi-Cal? What are some income requirements? And what if you are stuck in Kaiser?
Sure. So you can have both Medicare and Medi-Cal. Number one, I just want to make sure I point that out. Typically, you'll hear that referred to as Medi-Medi, meaning, again, they have Medicare and they have Medi-Cal. It sounds like if your parents have Kaiser with their Medicare, that's probably a Medicare Advantage plan, like we were talking about, that Part C. If you want to apply for Medi-Cal, you can go online. I think that website is probably included on our who to call for what. Again, I'll make sure it is if it's not already, but you can go online. You can go to your local social services agency. You can call now and do an application over the phone. Income requirements are always changing and kind of depend on which area you live in too. So again, all of that can be found online and with any of those specialists, or I often consult with Dr. Google, helps me out a lot. And then as far as being stuck with Kaiser, you might have to change during open enrollment. There's another program called, it's a free program called HiCap, and they do Medicare counseling. So they're trained, typically volunteers, who can help you look at your Medicare plan. And if it's not working for you or you want to make a change, they can help review all the plans that are available and give you a few options that may meet your needs. They can't tell you one specific one, but they can give you a couple options that maybe have coverage for the things that you might need the most.
Tamar shared, my mom has severe dementia. She's in a boarding care now, but her disease has progressed. She's living off of Social Security and supplemental Medicare now. She needs more support, memory care specifically. How does one transition into this with Medi-Cal?
Sure. So if your loved one already has Medi-Cal, I would start with one of the agencies that works with the assisted living waiver, and they can help you get onto that and, start helping you identify a boarding care that is more kind of catered towards individuals with memory loss. Typically with boarding cares, there may be residents who don't have any cognitive impairment, and there may be residents that do. Some boarding cares specialize in residents with memory loss, and some don't. So that can be a good fit as well. It doesn't necessarily mean she has to move into specifically a memory care. Memory care is typically associated with assisted living as a lower level, and then that higher level in memory care. But boarding care can still be a good option. It just may be a different boarding care that would be a better fit. But I would start with an assisted living waiver agency. There are specific ones who are allowed to and are certified to help with the waiver program.
And as asked, in order to receive vet services, is it required to serve during wartime or being injured during service?
Sure. Okay, so with the VA, different programs have different requirements. So depending on which program you're looking at, some of them do require that you've served during wartime or that you were injured during service, but not all. So each program is different. So unfortunately, once again, I can't give you an exact answer, but it depends on what you're looking for and your loved one's service. So each one does have different requirements.
Jennifer asked, how does one determine eligibility for all these various programs? Does the CRC OC have case managers and social workers who can help with this?
Sure. So we call our social workers here family consultants. They do provide case management services to registered clients. All of our services here at Caregiver Resource Center are completely free, by the way. And so when it comes to actual determination of eligibility, our staff would not be able to do that, but we can get you connected to the resource that can. More than likely, that would be legal aid or a Medi-Cal specialist. Those are the experts who really work within that area, who would be able to look at all the bank accounts, kind of the nitty gritty, and help you determine if you're eligible. But we're a place where you can call in and we can get you connected with the right places so that you're doing a little bit less kind of running around trying to figure all of that out.
Therese asks, your slide on assisted living showed the average cost of an assisted living facility is $4,500. I've been looking in OC for my parents, both of them, and it is in the range of $8,000 to $9,000. Where are the facilities for $4,500? I've looked all over OC.
Yes, number one, it's expensive. I absolutely hear you. So that is an average for the state of California, just so that everyone is aware. And so that might be part of why the average was around 4,500. Typically with assisted living, what happens is they have a base rate for room and board. And then depending on level of care, the cost increases. So if someone really only needs very minimal care, they're very independent, but they need a place to stay, they want to engage in activities and meals and things like that, you're going to have a lower cost. But once you start adding assistance with medication, assistance with bathing, reminders, all of those different things, it just gets more and more expensive. So that is definitely a challenge. And I would say also, if you are interested, they're called placement specialists. Typically, there's no fee for you as the person who's utilizing their services. I kind of think of them like a real estate agent, but for care facilities. And so you can talk to these placement specialists, let them know your budget, the area that you're looking, your loved one's needs, and they can kind of help guide you in narrowing down options that will meet your needs within your budget. But again, that 4,500 is an average for the entire state. Orange County is a bit more expensive than many other places throughout the state. But call
Gregory,
us and we can get you a list of placement specialists as well, okay?
yes. And then Gregory asked, if one attends a CBAS program, are their IHSS hours reduced?
So that's possible. It is possible that they would reduce your hours, because the thing is you can engage in all these different programs at once. If you have Medi-Cal, you can have in-home supportive services, you can attend a day program, you can get multiple benefits at once, which is amazing. I previously worked in a day program and we had many individuals who attended our program 5 days a week and still had that maximum of 283 hours for in-home supportive services. Sometimes part of that is just really advocating for yourself and your loved one. Because again, even with 5 days a week and maximum hours with IHSS, it's still not 24 hours a day. It still doesn't cover everything. So sometimes you kind of have to advocate for yourself to remain getting those additional hours, but it is a possibility. So again, not an exact answer, but I've seen many people who it didn't affect, and I have heard of a situation where it was affected.
Nancy asked, my mother has long-term care insurance. I'm looking at daycare centers. Should I be looking at daycare health centers to be able to use insurance to pay for it?
Sure. So with this question, what I would suggest is first contacting the long-term care insurance and asking how the coverage will work. Because again, when I worked at a day center in the past, some individuals that had long-term care insurance, we billed the care insurance directly, and it didn't matter whether it was social or medical model. Other insurance covered half the cost. Other insurance, the family did have to pay us directly, and then the insurance would reimburse them. So I would check with the long-term care insurance plan first. That would be my suggestion.
Gregory asked, under CalAIM, which government agency is responsible to administer the meal delivery program?
That's a great question. Unfortunately, I don't have an answer for that. CalAIM is really very new. And unfortunately, I haven't made any referrals to that specific part of their services, so I'm not able to answer that. But I will write that one down, and I'd like to know that for my own edification as well. And I will get back to you all on that one.
Kim shared, our adult son would like to provide assistance for his parent who has Alzheimer's. He's willing to quit his job as a social worker, but would need to receive funds to support his young family. How best to do that?
Right. So just based on that limited information, it can be difficult to get paid to be a caregiver. Typically, the way that a family caregiver gets paid is through that in-home supportive services program. So definitely exploring if the parent in the situation, the person who has Alzheimer's, could possibly get Medi-Cal and in-home supportive services. And then your son, I believe, your son would then be the provider for in-home supportive services hours. So again, just kind of based off that, that's what I would typically, how I could see that playing out.
Roberto asked, can we make an appointment with the CRC to explore which programs we might be eligible for?
So you don't even have to make an appointment with us. You can, but we have intake social workers assigned to the phone mornings and afternoons from 8 a.m. to 5 p.m. So you're welcome to call us, ask questions. We have families who call us once and they never call us again. We have families who call us every month with different questions. And then we have clients who want to get fully registered with us and have a family consultant or social worker who kind of can walk alongside them throughout this caregiving journey. So you are absolutely welcome to call us, and we can try to assist you to the best of our ability in helping you explore these different options that are out there.
And this is the last question I see in the chat from Inez. They asked, is palliative care covered by Medicare?
So typically palliative care would be covered by Medicare as long as the palliative care agency is Medicare approved. So again, you may have to call Medicare or your specific plan, or your loved one's plan, I should say, and ask them for a list of approved palliative care agencies. So that would be my suggestion there. Any other questions or comments on anything that we've talked about today? Again, I realize it is a lot of information. And this is being recorded, so we will be reposting this so that you can refer back to it, or, share it with other family members or loved ones. And then also I just see here, there's a comment. I believe the agency for receiving the medically tailored grocery boxes is called Project Food Box. You must be Medi-Cal recipient and live in Orange County, but you can also call Cal Optima to verify that. And then I've seen a few questions about getting copies of the slides. I'm happy to send that out. The more people that have this important information, the better. So we're happy to share this resource with you all. But with that, if there's no other questions, we'll go ahead and start wrapping up. And we are available. Again, you can call us. You can go on our website. We have a lot of different classes. We have a lot of different support groups, just again, to help you through this caregiving journey. We know it is not an easy one. And there's a question here, how do we get registered at CRC? So you can just give us a call. You can also go onto our website where there will be a link for a portal called CareNav. CareNav is where you can, it's a really actually very neat. It has a lot of resources, but you can register yourself for our program, and then we'll get notification you've completed that CareNav profile, and we'll be reaching out to you. But also, again, you can just call us. I have up on the screen right here our information, our name, our address, and our phone numbers. We have a toll-free number, which is 800-543-8312. Or we have a 714 number, 714-446-5030. And again, you can call us. We have social workers on the phones from 8 to 5, here to help and get you registered with us to get you more connected. Okay. And then I do see another question. Is there an agency to contact to get an advocate for a disabled adult? There definitely is. I will look into a couple, and I'll send that out in this follow-up email. I have a few off the top of my head, but I don't know their direct contact information, so I'll send that out in my follow-up email. Okay. And thank you all so much. We appreciate the feedback. We absolutely appreciate the questions. Both Gabby and I really feel honored to have spent this time with you. For those of you who are working, you have no time, and so you spent this time with us. And those of you who are caregiving, you really have absolutely no time. And so the fact that you chose to take about an hour and a half out of the time that you don't have to spend with us and learn with us and be present with us, we really are honored that you were here. So thank you so much. Please don't hesitate to reach out to us, join our classes and our support groups. Again, we're here to serve and we're here to help. So with that, we'll go ahead and we'll close out. Anything else you wanted to say, Gabby?
No, just thank you all for your time. Again, we're going to be sending out the email with the more information. But I hope you have a beautiful, blessed day.
Thank you so much, everyone. Have a great day and take care of yourselves. Thank you so much.